ER doctors and nurses. Have any of your patients surprised you with their amount or lack of pain tolerance? Story 1. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends and they all saw me slide and hit the wall. They came over and asked if I was okay. In a normal voice, I said I couldn't move my leg. No tears, screaming, or anything. No one believed me, but after a minute or two, I convinced them to call 911. The whole time I was waiting for the ambulance, about 30 minutes. I was talking to them normally and no one believed I was actually hurt, until I started going in and out of consciousness. Right as the paramedics got there, I started to wake up. They got out and they didn't think anything was wrong until they cut my pants off and saw my femur was almost protruding out of my leg. I had no kneecap and tops of the tibia and fibula were protruding out. They took me to the hospital. No drugs in the ambulance. As I was joking around with them, i.e. asking if I'm allergic to anything, I told them apparently stone walls. They got me to the hospital and rushed me into ER. Doctors came over and were shocked I wasn't screaming or crying. Then about an hour after the initial injury, the pain finally started once they started moving the leg. About 3 doses of morphine because one wasn't enough, and one of Dermarol. I don't remember the next couple days besides bits and pieces, but all the nurses and doctors told me I had one of the highest pain tolerances they've ever seen, although I imagine it wasn't really my choice. Mostly the brain just shutting down because I was in so much shock and had so much trauma. Being in shock is pretty scary and not always a good thing. When it can block out something like that and you have help, it's a pretty neat thing to have, I guess. So glad your friends finally believed you and called 911. Would hate to think of how much worse it could have been if they didn't or took longer. I hope you're doing much better now and staying clear of ice. Story 2. A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but can be quite fun as you can chat with the patients. My friend was engrossed talking to him about his experiences in the Second World War and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines, or in the trenches in Flanders. After he put the last stitch in, my friend started clearing up and found the local anesthetic bottle unopened. He realized he'd not put any local in it at all, and yet the guy didn't flinch once, leave aside complaining. When asked why he didn't say anything, he just said, "Oh, I thought that's how it was supposed to feel. I didn't mind. Lovely chatting to you." Then walked out. Don't make him how they used to. Lignocaine at it. Spoke to my friend last night. I didn't totally do the story justice. The laceration was sustained in a machete attack. 2 guys tried to break into the man's house and one slashed at him, but he fought them off long enough until a neighbor started to run over and they scampered. Such a relevant detail, how could I have forgotten? He had to clean the wound out thoroughly, which is even more painful than suturing. And to those of you pointing out the Flanders inaccuracy, that's purely my incorrect phrasing. It was World War II. So ignore the trench comment. I'll refrain from the obvious "I'm a Dr. Jim and not a historian" line. Or perhaps I won't. Did they just casually break into John Wick's house or something? That guy is an absolute tank. Veterans are not of this world and should not be messed with. Story 3. ER doctor here. My intern year in residency, I saw a 17-year-old kid who, while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail, causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting, separating, the nail from the tissue below it. If your stomach didn't turn reading that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting something around the nail. He felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knock him out. He looked at me in the eyes and said, "Doc, just take it off." Without anything? Yeah, it's fine. They fix our cuts without numbing medicine, but it's gonna hurt a lot. I have to scrape, I know. So I went to it. He grabbed a towel with his other hand and I went to work. 45 minutes later, the nail was removed. It was repaired and I replaced the nail in its rightful place. The kid didn't even make a noise. Too long didn't read. Hockey players are freaking bad A. Now that made me cringe inside and out, especially since I can relate because Novocaine doesn't work on me. I had to get a whole tooth pulled with nothing once, and about 8 stitches in my leg once with nothing. Although I can't say I was a bad A about it. I sound like a little baby, but in my defense, I was young and it hurt. Story 4. Working as an EMT, I got called to a 64-year-old female, slipped in her house, possible sprained ankle. When we got there, the woman was sitting in a chair with her legs stretched out in front of her, but she had long pants on and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all, so I figured this was going to be an easy trip. I kneeled down in front of her to take a closer look. And wasn't I surprised to find that it wasn't just broken, it was fricked right up. I mean, the foot was at a 90-degree angle to the outside, and it was also leaned down so what should have been on the side of her foot was facing straight down. Oh, and the bone that should have been holding the ankle in place were pushing the skin on the inside of her ankle, so hard that it was about to rip through. I was bewildered at the fact that at that moment she said, "It doesn't hurt, so I hope it isn't broken." She hardly made a peep on the ride to the hospital. 35 miles, very bumpy. Come to find out she had multiple sclerosis, and that makes people feel pain differently. Differently or just not at all? That is insane, and I think I'm about to throw up imagining that. Story 5. People have an unusual sixth sense for when they are going to die, or if something is gravely wrong. There's a point where either the pain or the sense of doom is so strong that the patient, who normally is freaking out if something legitimately bad is going on, suddenly gets quiet. The feeling of doom in the room is almost palpable. There have been instances when I walk in the room and suddenly the hair on the back of my neck stands up. Hopefully the pain is just something excruciating yet relatively tame, like really bad gallstones or blocked bowel, or maybe it's something more terrifying, like an aortic aneurysm, a ruptured appendix, or an MI. In this case, I don't want to jerk around on scene with extra questions. I want to get them to surgery ASAP. I once saw a pretty creepy saying for that kind of feeling before, but sadly I can't remember it, but it had something to do with spirits and it was pretty cool but bone-chilling. Story 6. I was a tech in the ER when the EMTs brought in an elderly woman with what they said was a sprained ankle. She had slipped while mopping a floor at work and her coworker had called it in. Turned out she had broken both of the bones in the lower part of her leg, but was sweetly chatting with us. I was impressed as soon as I saw the x-rays. EMTs had no idea and splinted her ankle over where her bones were broken. Typically, broken bones in the legs, unless there's a huge amount of angulation/displacement, do not cause a ton of pain unless moved. We see that often in old people with hip fractures as well. They're usually sitting there still and having no pain. But the second you try to move it, they're in excruciating pain. Same goes with trying to bear weight. Well, that explains the old lady's leg a couple stories ago. Story 7. EMT here. I once took a kid about 18 or 19 to the ER screaming all the way for sunburn. Sunburn! I mean, yeah, sunburn isn't fun, but this kid was claiming 9 out of 10 pain and whimpering. I was astounded. Charge nurse and I giggled about it for weeks. Edit. A lot of you guys have suffered from some horrendous sunburn, it seems. Ouch. That does sound like some squirm-inducing pain. This guy was barely pink and hadn't tried anything on his own yet. Only 9 out of 10? Most of my whimpering patients have 13 out of 10 pain. The ones that worry me are the ones that say they're in a 4 out of 10 and are sitting perfectly still trying not to move because every movement makes the pain a 10. Wow, thankfully I've never gotten a sunburn like that before. Could he have just been being a baby? Maybe. But regardless, I never want a sunburn like that in my life. Story 8. My grandma grew up on a farm in Alberta and was unbelievably tough. She once broke her finger by slamming in a car door and splinted it herself with popsicle sticks and duct tape. Later her appendix burst, but we didn't find out until they took her to the hospital because she passed out at dinner in the retirement home. She hadn't wanted to bother anyone by making a fuss. Finally, she was diagnosed with stomach cancer. It spread through her entire digestive system. After she went into hospice, my mom was cleaning out my grandma's apartment and found every single prescription bottle of painkillers mom had picked up at the pharmacy for her, unopened in a drawer. Knowing my mom would eventually find them, my grandma had written a note saying she preferred to keep her mind clear. She sounds like she was an amazing person and definitely a grade A bad A. Story 9. Radiographer here. As a student, I met a patient who was a typical little old lady. She came in with far too many shopping bags and walked extremely slowly. She'd been sent by her GP because she'd fallen out of a bath a few weeks previous. So we brought her in and took the first image. AP pelvis if you were wondering. And her pelvis was absolutely ruined. Turns out she had slipped and fallen with one leg in and one leg out of the bath, and taken the whole fall on her woman part. Not wanting to cause a fuss, this woman had ignored the pain and carried on her life as normal for weeks. Long enough for the fractures to be fairly healed, albeit in a strange way, not really resembling a pelvis much anymore. Why is it so common for older people to not want to be a fuss when something bad happens to them? Like, no one is going to care if they need to help you. Not at all. Story 10. Not a doctor, but my goddaughter was born very prematurely, requiring a major open heart surgery at 2 weeks old. We were told by her docs that since she'd gone through so much surgical trauma the first few weeks of her life, as a neonate, her pain receptors/nerve endings would not develop normally. They gave us the example that if she put her hand on a hot stove as a kid, she would have sustained a severe burn without feeling any pain whatsoever. She never cried as a kid when she got a shot/fell down/banged into things, even when it was enough to draw blood. I suspect her medical history was the case. There used to be a kid I knew like that. He always called himself a superhero because of it, and I was always so impressed. I hope he's doing good now. Story 11. Working in a hospital has taught me the downside of abusing painkillers/drugs. Patients constantly come in here with long-term substance abuse issues and now they are actually hurt. MVC, broken bones, etc. You can give them enough drugs to put down a horse and they still feel everything. That is one of my biggest fears. I had a major back surgery when I was 14, so I pretty much live with constant pain. I will do everything I can to avoid taking Vicodin so that when I get older and I really start to hurt, I haven't built up a tolerance. The only thing that sucks about it is that pills expire before I use them all, and so when I really do need them, getting a new doctor to prescribe them is really hard. They always treat me like I'm a junkie trying to score. While it is understandable, it really ticks me off. Well, yeah, I would imagine. Being in that much pain and the doctor just thinking you're making it up for a score has to be so frustrating. Story 12. ER doc. 50-year-old guy with massive heart attack just lying there chilling. Ask him his pain level, deadpan, just a little. 5-year-old boy with both forearm bones fractured and dislocated, playing on iPad with other arm. 6-year-old lady slips, falls, destroys pelvic bone. Just wants one Tylenol and scooches out of bed wanting to walk home. After much convincing, she begrudgingly accepted that might not be a great idea. There are some bad A people out there. Story 13. Not ER, but actually a cashier at a fast food place. A woman ordered 2 meals, and said she was a little older, really old actually. I offered to bring her food to the table so she wouldn't have to wait. I get there, and her husband had wads of paper towels stuck all over his arms with electrical tape, and his right hand and part of his face were a mix of blood and second-degree burns. Turned out he was working on his lawnmower, and the engine blew up on him. They stopped for lunch on the way to the hospital for burns, and the metal they just couldn't get out. He was acting like it was nothing. Stopping for lunch on the way to the hospital? And with that, no less? And here I am not eating because of a tummy ache. Story 14. Not an ER nurse, but a medical technician at a couple of large events in my country. Working at a racing track, I had both of these people come in on the same day. Male, 54 years. Swedish, small cut on hand. His reaction to me pouring water, saline in his wound. Ow, 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 it hurts when you put disinfectant in there, be careful. Male, 32 years, Finnish, deep cut in right forearm. His humeral bone was visible. No, it doesn't hurt. Now just tape it the frick up so I can get back on my bike. That second guy is the definition of built different. Story 15. Fire/medic here. Farmers seem to be tough. One time a guy pulled into the front ramp, got out of his truck and walked holding his severed forearm in his other arm. Get him in the truck, take off. Along the way, he states he lived down the road and wanted to get to us quickly. When asked why he didn't call 911, he replied, "I just cut my arm, I ain't dying." Also had a battle with a bulge vet telling me he didn't need a blanket. It was -7 with a wind chill. So if he drove to you, did he just have his own forearm in the passenger seat or something? Story 16. I was chatting with my physiotherapist one day about pain tolerance, and she said that she once had a cocaine addict as a patient whose tolerance was absolute 0. She couldn't even touch him without him perceiving it as painful, let alone stretch or manipulate his body. She said he was a very challenging case. I would imagine. Just yet another reason to not do drugs, kids. Story 17. ER doctor here. I can't count on 2 hands the number of patients I have seen that are covered in tattoos and are scared of needles/IVs. I mean complete phobia. It makes absolutely no sense. If anyone can enlighten me as to how this phenomenon can exist, I'd appreciate it. Story 18. I had a patient with an open tib-fib fracture. The bones in the lower leg sticking out, and below that it looks like jelly. Trying to walk away, apparently unaware of how bad his leg was. Of course he was incredibly drunk at the time. I was just thinking I bet he was drunk before finishing and seeing he was in fact drunk. Hope you guys enjoyed the video. Please like and subscribe for more videos to come, or else this spider will be in your bed tonight.